So my name is Jonathan Wright. I'm a urologist at the UW-SCCA and a researcher here at the Fred Hutch. And I'm going to talk today about prostate cancer prevention. It's always fun to talk about this because if we can succeed at this, we will put all the other speakers out of business. So I'm going to talk briefly about three different concepts. One is some of the studies that have been done looking at pharmacologic or chemo prevention of prostate cancer, different medications and supplements. I want to focus on the role of good old diet and exercise, and then also introduce the concept of secondary prevention of cancer as well. So first, 5-alpha reductase inhibitors. I know many of you are aware of these. These are a very common medication that we see a lot of. They're known as finasteride or dutasteride. Many of you will know them as Proscar or Avodart. These medications block the conversion of testosterone to a more active androgen called DHT. And the reason why we thought that these might have an effect on preventing prostate cancer is that androgens are required for prostate cancer. DHT is more potent than testosterone. And the rare man that doesn't have this ability to convert testosterone to DHT doesn't get prostate cancer. So we have these medications, and they've done some studies. The PCPT study, almost 20,000 men randomized to either take Proscar, finasteride, or a sugar pill. 7-year study, men got biopsied either for rising PSA, abnormal exam, and at the end of the study, all the men were offered a biopsy. And they found that in the men that took finasteride, there was a 25% reduction in the overall risk of prostate cancer. And this was present, didn't matter what age you were, race you were, family history, across all different arenas, a 25% reduction in incident prostate cancer. And this is in addition to the other benefits of this medication. Anyone that's ever taken this knows that this shrinks your prostate. And for us men, as we get older, we have more difficulty urinating. Shrinking the prostate improves our urinary symptoms. It also, under a different brand name, is called Propecia. So it also helps us men with our male pattern baldness. So there are a lot of benefits to this medication. But for those of you like me that take a medication, everything's got a side effect. The main downsides that we know of this, about 1 in 10 men get erectile dysfunction from it, and about 1 in 50 will have develop more breast tissue, gynecomastia. But the bigger problem with these medications, and from what we found in the study, was that in those men that got prostate cancer, there was a higher risk of having more aggressive prostate cancer. So in the men that had prostate cancer who took finasteride, 37% of those men with cancer had Gleason 7 to 10 cancer. Whereas in those men that were taking the sugar pill and had cancer, only about 1 in 5 had the more aggressive Gleason 7 to 10 prostate cancer. And why is this? Is it that it's actually letting the more aggressive prostate cancer grow? Is it blocking just the lower grade prostate cancers? One of the ideas is that potentially it's a sampling issue. As I said, you shrink the prostate when you take this medication. And we're basically taking organized blind biopsies of the prostate. So if you have a smaller gland, decreasing the gland size by about 30%, and then you stick these needles in it, you may be more likely to find that small little bit of the more aggressive cancer. And when they do modeling where they account for this shrinkage, the difference in aggressiveness goes away. And in men that went on to get radical prostatectomy after this study, there was also no difference in the aggressiveness that was seen. Once we had the whole prostate out, chop it all up, and see if there was no difference in aggressiveness. There was a second study called the REDUCE study. This took men who had already had 1 biopsy for prostate cancer and they didn't have any cancer on their biopsy. It randomized them instead of to Proscar to Avodart or to a sugar pill. 4-year study, and men got biopsied at 2 years and at 4 years, or if there's another indication to be biopsied. And they basically found the same thing. There was a 23% reduction, so almost a 25% reduction in the risk of finding prostate cancer, both at the year 1 to 2 biopsy and at a later biopsy. But the problem was, just like what was seen in the PCPT, there was an increased risk of higher grade prostate cancers. The 8 to 10, the more worse players had a higher risk. And all of this has tempered kind of the energy for 5-alpha reductase inhibitors. And the FDA has actually put a warning on it that says that they have to inform healthcare professionals that in the warning and precaution sections of the label of these medications, they've been advised to include a new safety information about the increased risk of being diagnosed with a more serious form of prostate cancer. But still, it does decrease the risk of overall prostate cancer significantly. And recent data published this year at GU ASCO hasn't yet shown any difference in death rate for patients taking 5-alpha reductase inhibitors either. But many of us hate taking medications. We prefer a more natural way to do it. There have been a couple studies that have looked at vitamins and minerals and supplements. The SELECT trial, 30-plus thousand men, vitamin E versus selenium, people taking either sugar pills or different combinations of vitamin E and selenium. They closed the study early because of this. So this shows years after the study started. This is the risk of the incidence of having cancer diagnosed. There were 4 different curves here, and they're all basically on top of each other, except for one that had a little bit higher. And actually, there was a near significant increased risk in prostate cancer in those taking vitamin E over those that weren't taking it. And there was a non-significant increase in type 2 diabetes in those that were taking selenium. So certainly problems with that as well. And they didn't decrease the overall risk of prostate cancer. Another huge study, 14,000 physicians randomized to vitamin E and vitamin C. You can't tell here, but it's hard to tell, but there are actually 2 lines in these. These are the 2 lines for those that took placebo or that took either vitamin E or vitamin C. They're on top of each other. It did not prevent prostate cancer, either of these medications. Disappointing results for sure. And so then I would step back and say, what are we actually trying to prevent? On the right here is Gleason 6 prostate cancer. It doesn't take a pathologist to look and see that there's little circles here. There's kind of some actual organization. Maybe there's little wheels here. All of us can see that. This is the more common cancer. And over here, in this Jackson Pollock totally chaotic picture, is Gleason 10 prostate cancer. And so maybe rather than trying to prevent this more common cancer, we should focus on the much bigger problem of preventing the higher grade prostate cancer. Now, if you ask most physicians, what's the biggest problem out there for us, period, it's this. This is the evolution of our man over the past 30 years to significant obesity, bad diet. We've heard about that already. And nobody exercises, or if they do, they go to the gym and they take the escalator. And if we look at activity, look at our exercise. These are a couple of big observational studies, and both of them show the same thing. Those men that exercise on a weekly basis, and I'm not talking about sprinting and those kind of things, this is just brisk walking. Those that are in the highest level of activity, in one study, had a 70% reduction in the risk of advanced prostate cancer, cancer that's spread already. Another study, again, 70,000 men, those doing higher levels of basic physical activity, had a 30% risk reduction for aggressive prostate cancer, Gleason 7 to 10, just with exercise. What about obesity? Lots of studies have shown this. They merge over 1 million patients without cancer, and they look at the 7,000 cancers that developed. For every 5-point increase in your body mass index, your BMI, you had a 15% increased risk of fatal prostate cancer. So a normal BMI is less than 25. Overweight is less than 30, and obese is 30 to 35. So if you go from 25 normal weight to 30 overweight to 35 obese, each of these 5-point increases 15% increased risk of dying of prostate cancer, of having fatal prostate cancer. So what specifically in the diet? We heard a great talk already about this. There's the fried food with a shout out for Marnie. And also we had another paper as well that many people in this room were a part of, where we found that there was an increased risk of aggressive prostate cancer for those that ate the highest quartiles of red meat. Well, what do we commonly see with obesity? Diabetes, type 2 diabetes. Very common that these 2 things coexist. The most common medication, generic, very cheap, is Metformin. It's safe, it's well tolerated, and growing data suggests that it has anti-cancer properties. We've looked at this in some of the data set that Dr. Stanford already talked about. We found, and this got caught up at the bottom here, but the overall risk of prostate cancer for men taking Metformin was reduced, and it was present, and this reduction was seen both in less aggressive and more aggressive prostate cancer. So I again raised the question, what are we trying to prevent? Now, all these first sets of slides are for men without prostate cancer. That's great, but preventing prostate cancer doesn't help a damn for someone that already has prostate cancer. And that's where secondary prevention comes in. This is a list of the top 10 male cancers for diagnosis. There's prostate. What we want to do with secondary prevention is keep someone from joining this list, which is the estimated deaths, the incident deaths of cancer, where prostate cancer is number 2. So of those men that are in this, let's block them from coming over here and joining this. If we come back to obesity again, men with prostate cancer, same thing. Every 5-point increase in your BMI, 20% reduction in prostate cancer mortality. So not only does it prevent the development of aggressive prostate cancer in those without it, but those with it, obesity leads to higher death. And this graph right here kind of shows that. Time from diagnosis, how many people are still alive. This lowest curve here, the greatest deaths are in the obese category, BMI 30 to 35. And these data came out of Dr. Lennon, Dr. Stanford, and Dr. Crystal here, right here at the Fred Hutch SCCA. And these data were some of the ones that were added in and included in that big, huge analysis. Well, what else? High blood sugar and prostate cancer progression. I tell patients more sugar for you is more sugar for the cancer. A very simple, a very simplistic idea. We looked, everyone that goes to the doctor gets a fasting blood glucose. You can't eat before you get your blood drawn, and they look at your fasting blood glucose to try to figure out what's your risk of having diabetes. A glucose score of over 100 is considered abnormal. Well, we took over 1,700 men that had prostate cancer and were treated, and we looked what was their fasting glucose, what was their glucose level before treatment. And we found that if you had an elevated glucose at the time of diagnosis, you had a 50% increased risk that your prostate cancer would recur. And that's after adjusting for Gleason score, PSA, all these things, treatment, radiation versus surgery. This data has recently been published. A lot of people here have been involved in this, including our next speaker, Dr. Gore. So how do we improve blood glucose levels? 2 ways. Diet and exercise, that helps. And metformin. We came back to metformin again. And again, this gets cut off, and this went up at the wrong spot. But what this shows is that those people that take metformin, the highest group of people taking metformin had a reduction in the risk of prostate cancer recurrence. Metformin, which lowers glucose levels, those that took the most of it had less prostate cancer progression. With the diet we've done here through the Fred Hutch, supported by the SPORE, was a pilot study where we randomized men to a 6-week dietary intervention at the Fred Hutch Cancer Center. We found men lost weight, the diets got better, and we saw improvement in diabetes-related proteins, C-peptide, glucose, insulin, and others. So certainly things we're doing here as well to try to improve these numbers. So what do we need to do? What's our next step? Secondary prevention trial, taking those men that already have prostate cancer, giving them metformin, introducing them to diet and exercise to see if we can build on what we're doing here to help prevent prostate cancer progression and recurrence. But what's even more important, I think, is that if we do this, if we improve patients' weight, if we improve patients' sugars, not only will we improve their health-related prostate outcomes, we're going to improve their overall health. And that's a pretty good thing to do, because most of us are going to die of heart disease anyway. And if you lose weight, and if you improve your sugars, you're going to improve your heart disease. And if you don't think that this is a big problem in the United States, this right here is a map where each state is color-coded based on the percentage of people, of adults, that are obese, BMI greater than 30. You will see that there's not a single state that has fewer than 1 in 5 people that are obese. Half the states have at least 1 in 4. And a third of the states have 1 in 3 people, adults, that are obese. This is a huge epidemic in the United States. If we can improve this, we can also improve prostate cancer. Thanks.